The president has pretty much demonized a health insurance company, and I understand that. It's easy to be mad at insurance companies. A couple of things you might not be aware of. For example, are you aware that Medicare is twice as likely to deny your claim as any private insurance company? Look, I'm not trying to be overly defensive of the insurance companies, but I want to talk about some of the laws of unintended consequences that I think we need to know. Here's one. I believe that within 5 to 10 years, the only person or the only entity that will be insuring anybody will be the government. And let me explain why. If insurance companies are forced to insure people without any consideration for their state of health at the point at which they insure them, then do you realize that there's no way that insurance companies can stay in business? Now, I'm going to just ask my studio audience, how many of you here drive cars? Can I just see your hands? Most everybody. How many of you, keep your hands up for just a second, if you drive a car, how many of you have insurance, some type of insurance on your car? All of you. Because if you don't, you're breaking the law. Okay, just making sure you understood that. But it's a little different here. You don't have to have insurance that covers collision and comprehensive for theft. You have to have liability to protect the other guy, not yourself. And if the bank owns part of your car, you have to have it to protect the bank's interest. But once you own your car, the only thing you have to protect is the other guy. So here's the question. Suppose you had an insurance policy for your car that covered everything, oil changes, gasoline, covered the wiper blades. Would that insurance policy cost you more than the one you currently have? A lot more? Of course it would. What about your home? All of you here have homeowners insurance or renters insurance? Okay. What if it covered everything? Mowing the grass, it covered your utility bills. Could you afford it? No, you couldn't, because it would be cost prohibitive. Here's one. What if you could buy the insurance after you had the claim? No, seriously, let's say you call up and say, I'd like to insure my house. Oh, really? Tell me about your house. Well, it's burned to a crisp. I'd like to insure it. You say, well, that's crazy. You can't do that. What if you could call up and say, I need some life insurance, $3 million. Oh, really? Tell me about who's it for. It's for my husband. Well, how old is he? Well, he died yesterday. You can't do that, can you? When you ask the insurance companies to insure someone after the fact of their illness, now look, it sounds wonderful to say we should force these evil insurance companies to do that. As long as you understand that what you're asking them to do is to automatically become unprofitable, and there's no way they can stay in business. Now, for some people, that's delightfully good news. They don't want them to be in business. And if you want a totally government-run health care, we are rapidly on our way. I will predict that very few insurance companies will be able to operate in the marketplace where the government says you must take all comers and you can't limit anything. The law of unintended consequence of this bill is everybody, if they have any insurance at all, will be insured by the government. Here's a second one. There will end up being 2 classes of medical care. And I want to say this so that you'll understand. 2 classes of medical care. One, concierge care for the very wealthy people who can afford what they want. And the other class of care will be that class of care that basically poor people in this country will have. Now, when I hear about universal coverage, you'll have it, but you'll line up for it, you'll wait long periods of time, and I want to explain why. Doctors now, under the new rules, will be forced to take a payment that is set by the federal government. They will be forced to give a service that is determined by the federal government. The problem is that many physicians have worked very hard. They owe a lot of money for medical school, and they will end up having a market-based choice. They can go to work, in essence, for the plans that the government allows and creates and be limited. Or what will happen, people with money aren't going to want to go and sit in a doctor's waiting room for a long period of time, and we'll see more and more people go to private physicians and say, look, I will pay personally whatever it costs, because they can. What does that mean? It means that a whole lot of people are going to get extraordinarily good care, or excuse me, some people will get extraordinarily good care, and a whole lot of people will get mediocre care. I totally understand that we don't want a system that leaves truly needy people without a safety net. Now, let me be very clear. A safety net is a good thing. A hammock is a bad thing. And a safety net means that you're going to be protected from those calamities that you can't do anything about. But a hammock means that you're just basically going to be given whatever you want, whenever you want it, and somebody else is going to pay for it. Let me mention another. Loss of medical innovation. We are going to tax and put penalties on companies that sell medical devices, and we're going to put a big, just bonus hit on the pharmaceutical companies. Sounds very popular. After all, they're making a lot of money. But I doubt there's a person here or any of you, in fact, I would just ask this question, how many of you have taken a prescription medication in the last 3 months. Pretty much everybody here. Now notice I didn't say a non-prescription narcotic or illicit drug, because we do have people who watch from the DEA. I want to make sure that I don't get my audience in trouble. But most of us here have had some prescription medication for something. Now, many of those prescription medications are relatively new, and they do extraordinarily good things for us. They keep us out of the hospital and are much less expensive than would be a long-term illness or maybe the calamities that would come. What happens when drug companies no longer work to innovate? When medical device companies don't create those wonderful prosthetics that make it possible for a person who's lost a limb in the Iraq War to come back and still be able to walk or even run marathons? That happens when there is an incentive of profit to be able to do those things. The law of unintended consequence is when there is no incentive and when those things cease to be created and we don't get the benefits from them. Now let me think of something else here. There is a marriage penalty in this bill. You may not have thought about it, but you're going to be hit with additional taxes if you or your small business makes $200,000. If you and your spouse make $250,000, then you fall under that tax as well. Now, think about this. An individual, $200,000. For an additional $50,000, and many small businesses operate with gross income of far more than that, even though they don't make that much money. The problem is that if you're two people just living together, you get a $400,000 exemption. If you're married, it's limited to $250,000. I don't know if my wife understands this, but we might be better off. No, I'm not going to do that. I'm not going there. Here's another thing. A lot of questions about abortion. It will be covered. I know that there was an executive order signed. I was a governor 10.5 years, signed lots of executive orders. Did it all the time. I can tell you something about how executive orders work. An executive order means that you tell the people in the agencies within the executive branch what they have to do within the context of what your control is. But I could say to the employees at the health department when I was governor, all of you are able to have an hour and a half for lunch on Friday. I could do that by executive order. But if the legislature, the next legislative session, came in and said no state employee can have a lunch longer than 45 minutes, then my executive order doesn't mean diddly squat. Because law always trumps an executive order. That's why we have the branches of government that we have. When President Obama said we're going to have this executive order, what he really said was, ha-ha, the bill's already passed. I'll sign a piece of paper that is nullified in advance of the executive order. And when people say, oh, but it's under the Hyde Amendment, I want to remind you of something. The community health centers, where the most likely place for abortion funding happens, is outside of the funding of the Health and Human Services budget, which is where the Hyde Amendment applies. It does not apply to the specific funding stream of the community health organizations. So there were some congressmen either knew better and weren't honest with us, or they didn't know better, and if they didn't, why in the heck are they still in Congress? And that may be the biggest question. If you're really upset about the way things have turned out, there is something you can do about it. And it's not make angry phone calls or threaten anybody. I'll tell you what you can do. If you want to punch something, punch a ballot, not a person. And don't get all angry and scream and yell. That doesn't solve anything. What really does solve America's problems is when Americans realize that we, the people, still have the power.